Our family moved to Indiana from New Jersey back in the 80s, and both my parents smoked, but my mom quit before she got pregnant with me. But my dad never quit. He always snuck them around. We found him all sort of spots hidden in the house. When I was living here in Indianapolis and working, I had purchased a new house with my husband, and he was helping paint that house, but he was having a lot of rib pain, and he fixed cars. So he just assumed he had hurt his rib laying under a car. But it persisted. He went to the doctor, had it biopsied, and it was stage 4 undifferentiated lung cancer that had already spread to his bones. So we were all pretty devastated. He went through months and months of chemo and radiation and just left him pretty much at death's door. My personal story is that I watched so much suffering at the hands of tobacco. I watched how much money Medicare sunk into him. In 1 year alone, it was $256,000 between scans, labs, chemo, that was never going to save his life before he died in August of 2016. And after that, I said, I'm gonna do whatever it takes to decrease smoking rates in Indiana, prevent people from smoking. I tell his story to every patient that'll listen. I try to say it with grace and compassion because it's hard to quit. You can't berate somebody. You can't make them feel like crap. You have to really share your heart and soul and let them know you can quit. It's gonna be hard, it's gonna be a bear, but you can quit. I think sometimes patients are scared to come to the doctor because they think, they're gonna tell me my blood pressure's high, they're gonna tell me I'm overweight, and they're gonna yell at me for smoking. So I think that what patients really need to hear is, are you smoking? How much are you smoking? What can I do to help you quit? Are you ready? And if you're not ready, why aren't you ready? Does anybody in your family quit? We know that, if you've got your husband smokes, your kids smoke, grandma smokes, and you're the only one that's ready, it's gonna be really hard. How can I engage your family? What kind of tools can I give you to quit? So there's lots of different things we can do to help, and you just don't try once. You talk to that patient each time they come in, maybe you bring your nurse, maybe you give them a phone call after the fact, you refer them to the quit line, but you do it in such a kind way. You share your story. I share my personal story every time. I want them to know that there's hope for quitting, that you can feel better, you can do this. This is not a death sentence. I often say to them, would you want your kids to smoke? No one has ever said yes. So I say, I can help you. And if you're not ready now, when you are ready, I'm here. I'm always here. There's nothing negative that can come out of raising the tobacco taxes. Not one thing. And you can't send me some argument that I can't battle against. There is not one negative thing that can come out of raising the taxes. So every legislator can get behind this. We should not fail. We'll only be failing the citizens of our state.